A shadow hangs over the American healthcare system. A dangerous loophole in FDA regulations has allowed a black market in Ozempic knockoffs to flourish. Pharmacies, exploiting this blind spot, are peddling unregulated copies of the popular weight loss drug. This is not about meeting legitimate needs, this is about profit, and the price could be people's lives. Ozempic, intended for diabetes treatment, has become a sought-after solution for weight loss. High demand and limited supply have created the perfect storm for these knockoffs. These copies lack the rigorous testing and oversight of FDA-approved medications. What are consumers really injecting into their bodies? The truth is, no one knows for sure. The FDA loophole was intended to address drug shortages. Instead, it has opened the floodgates to a billion-dollar industry of unregulated weight loss medications. The risks are undeniable. Quality control is non-existent. And the potential consequences are terrifying. This is not a game. This is about protecting the public from a serious health threat. The desire for a quick fix, for a magic bullet to melt away pounds, has blinded many to the dangers lurking beneath the surface. They crave the transformative effects of Ozempic, the promise of a slimmer, more socially acceptable body. But this desperation comes at a steep price. Reports of horrific side effects from these knockoff drugs are surfacing with alarming frequency. Gastrointestinal issues, debilitating headaches, even kidney problems plague unsuspecting users. These are not isolated incidents. They are a chilling testament to the dangers of unregulated medications. Worse yet, the lack of oversight means these cases are likely just the tip of the iceberg. Without proper tracking and reporting, the true extent of the damage remains shrouded in secrecy. This is a public health crisis waiting to explode, and the clock is ticking. While countless individuals suffer the consequences of this reckless industry, the very entities responsible continue to deny any wrongdoing. Compounding pharmacies, the architects of this crisis, insist their actions are justified. They claim to be filling a void, ensuring patients have access to essential medications. Their defense rings hollow in the face of overwhelming evidence. The FDA loophole was never intended to create a backdoor for mass-producing, unregulated drugs. It was meant to address isolated shortages, not to fuel a lucrative market driven by vanity and profit. The truth is, compounding pharmacies are playing a dangerous game. They are gambling with people's lives, prioritizing profit over safety. And until they are held accountable, the suffering will continue. Legal battles loom. The pharmaceutical industry, witnessing the erosion of its profits and the blatant disregard for safety, is finally taking a stand. Legal battles are being waged against these rogue pharmacies, seeking to shut down their operations and protect their intellectual property. Eli Lilly, the maker of Ozempic, has filed lawsuits against several compounding pharmacies, accusing them of patent infringement and endangering public health. These legal battles are not just about protecting profits, they are about drawing a line in the sand. The outcome of these legal battles remains uncertain, but one thing is clear: the fight is far from over. The stakes are too high, the potential consequences too dire to allow this dangerous industry to continue unchecked. A call to action. This is not a problem that will solve itself. It demands immediate and decisive action. The FDA must close the loophole that has allowed this crisis to fester. Congress must pass legislation imposing stricter regulations on compounding pharmacies. We cannot stand idly by while people are harmed by these unregulated and potentially dangerous drugs. Contact your representatives. Demand action. Spread the word. The health and well-being of countless individuals hang in the balance. The time for complacency is over. The time for action is now.